Dear friend, this is a case of UBE TLIF. In this case, L34 and 45 decompression plus fixation is done, and we use 2 kgs. And this patient has a severe unstable segment of L3 and L4, so I put a double cage. This is more stable cage, and through endoscopic route. This is the AP view of the same patient, and in this image you can see laterally herniated disc on the left side. It was elevating the exiting nerve root superiorly. Then in this case, after preparation of the end plate and removal of disc and thorough preparation, we put a 10 into 10 millimeter into 22 millimeter titanium cage, first cage, because of around 1.5 centimeter corridor through the ENR and TNR, that is in the Cambrian triangle, we can easily put 2 cages, and this provides this stable fixation. This is the first cage being introduced. In 7 o'clock there is exiting nerve root, and at 12 o'clock there is traversing nerve root. And this is the cage, and after introducing the cage, the introducer is removed, and cage is positioned horizontally, and after horizontalization of this cage, another cage is introduced and positioned on the same side. This is banana cage, and banana cage is wider, it is 22 centimeter wide, and 2 cages provided total 44 millimeter of contact area between 2 end plates, and this 44 millimeter base is more stable one, and this is all done through UBE in the bloodless field, and all the process involves placement of both cages as well as percutaneous screw fixation. So the amount of trauma to the muscles is minimal, and normal structures are not much disturbed, and corridor is wide and better, even it is just like open, but the muscle trauma is less, so there is less fibrosis, less bone trauma. The bone is derived from the cut inferior articular process, superior articular process, and lamina. So this bone is placed first, then cage 1, and then cage 2, and this is all about the fixation of this UBE TLIF transforaminal lumbar interbody fusion. You can see the cages and the end plates, bony end plate, they're reddish in color. This is after removal of the cut in the end plate, and well horizontalized and fixed. First cage, you can see the dimensions 10 into 10 into 20 millimeter, the first cage, and now we will go for second cage, and this is all about second cage in the next video. In the similar fashion, we can put the second cage. In this video, we can see introduction of second cage with bone graft in the cage, and this cage was having something very rough surfaces inferiorly and superiorly, but because of the wide corridor I was able to introduce this cage. And this is also the dimensions are same as previous cage, 10 into 10 into 22 millimeter. And after introduction this cage, the horizontalization is done. You can check the exiting nerve route at the 7 o'clock inferiorly, and at 12 o'clock there is exit traversing nerve route, and we are in the Cambian triangle. And this is the second cage, almost totally introduced into the interbody area, where the end plates are well prepared, and the cartilaginous end plate is removed, while the bony end plate, which bleeds and very vascular, helps in. And this is the intraoperative X-ray. So with 2 cages in place. Thank you very much for your kind attention.